Today, we're going to talk about hepatitis B. Hepatitis B is often called the silent virus because it does not announce itself. It hides, it waits, and by the time the symptoms show up, the damage may already be done. But here's the good news. This isn't a story about fear. It's a story about faith, wisdom, and prevention. Because hepatitis B can be stopped before it ever starts. There's a vaccine that can protect you, and there's knowledge that can empower you. And there's a guide who gives you strength to walk in both faith and in action. Your liver is more than an organ. It's a living reminder of how fearfully and wonderfully you were created. It filters your blood, the liver does. It stores energy. Yes, the liver stores energy, and it keeps your body balanced. But it needs your partnership to stay healthy. So today we're going to expose what hepatitis B really is, how it spreads, how to prevent it, and how to care for the body God has entrusted to you. Because health isn't just about surviving, it's about thriving, body, mind, and spirit. Hepatitis B, also known as HBV, is a viral infection that attacks your liver and can cause both short-term and long-term illness. The virus is carried in blood and certain body fluids, which means it spreads through contact, not food or water like hepatitis A. Your liver is one of the most vital organs God created. It cleans your blood, it stores nutrients, and gives your body energy. But when the hepatitis B virus enters, it inflames and irritates the liver, making it harder for this powerful organ to do its job. Hepatitis B is sometimes called a silent infection because many people don't realize they have it. It can live in the body for years before symptoms appear. And by then, serious damage, such as cirrhosis or even liver cancer, may already have begun. The amazing news is hepatitis B is preventable. God gives us wisdom and science to work hand in hand. And through vaccination, awareness, and early testing, this disease can be stopped before it even starts. Hosea 4:6 says, "My people are destroyed for the lack of knowledge." Knowledge is protection. Knowing how this virus spreads can literally save your life. So how does hepatitis B spread? Well, it spreads through contact with infected blood or body fluids, such as sharing needles, razors, or toothbrushes. Yes, even toothbrushes. From mother to baby during childbirth. Unprotected sex with someone who carries the virus. Unclean tattoo or piercing equipment. Accidental needle sticks in healthcare settings. It does not spread through casual contact, such as hugging, coughing, or sharing food. And some of the common symptoms are, now, some people have no symptoms at all, but for the ones that may be experienced, could be fatigue or weakness, fever, loss of appetite and or nausea, pain in the right upper side of your stomach, also called your abdomen. Your urine can be dark, or your stool, your poop, can be pale looking. Also, you may become yellow in your skin or your eyes, which is also called jaundice. Even if you feel fine, you can still carry the virus and pass it to others. That's why screening is so important. Some of the ways that you can prevent hepatitis B is by getting vaccinated. The hepatitis B has a vaccine. It's safe, effective, and long-lasting. It's usually given in a series of 2 to 3 shots over several months and provides protection for decades. Babies are often vaccinated at birth, but adults who missed it can still get vaccinated at any time. Next, avoid sharing personal items such as your razors, your nail clippers, and even your toothbrushes that can still carry small amounts of blood. Always use your own items. Next, if you're sexually active, use condoms to reduce the risk of spreading or catching the virus. And biblically, we know that we are to remain abstinent from sex until married. But if this is not your case, then please protect yourself at all costs. Check the tattoo and piercing equipment that is used. Only go to clean places that use sterile, safe, single-use needles and get tested. If you were born in or have traveled to countries where hepatitis B is common, get screened. Early detection saves lives. There is no cure yet for hepatitis B, but there are medications that can control the virus and reduce the risk of liver damage. Antiviral medications help keep the virus quiet. Regular checkups allow your healthcare professionals to monitor your liver function. And people with acute infection usually recover on their own with rest and proper care. And to support your liver, avoid alcohol products completely. Eat a balanced, low-fat diet rich in fruits and vegetables. Stay hydrated and exercise regularly. Never share personal hygiene items. Even if you have chronic hepatitis B, you can live a long, full, healthy life with proper management. Now that you know the truth about hepatitis B, the question isn't, what did I learn? It's, what will I do with the information that I did learn today? Because we should all know knowledge without action does not bring transformation. Obedience does. God has given us the wisdom, the science, and the resources to protect the very temple he placed our spirits in. All he asks is that we walk in it with wisdom. If you've never been tested, get tested. If you've never been vaccinated, take that step. If you're already managing this condition, know that you're not alone. Healing is not just possible, it's promised. So today I speak health over you. May your liver be strong, your body and your faith unwavering. May you walk in wisdom and not fear, in prevention and not panic. And may the peace of God guard both your heart and your health. Before you go, I love to hear from you. What's one step you're taking after today's message to protect your health or help someone else protect theirs? And what topic would you like for me to talk about next? Drop your comments below. Share this message with someone who needs it. And remember, health is not just about living long, it's about living well on purpose. Until next time.